Hello, dear aquarist. Welcome again to one of my cases of fish diseases. And today you selected one about a Malawi cichlid, an African cichlid, Aulonocarra. Can be very beautiful, very colorful. But today, unfortunately, I have to show you a sick one. And it can become sick, of course. Fish is life, and a breeder can breed fish and also can breed or cultivate fish diseases. And I show you my PowerPoint where I can share you my findings. What diseases we found on this Aulonocarra. In my case 359, we found tubercles in the organs and internal parasites Cryptobia iubilans. Interesting. Interesting parasite to observe. So I hope my microscopic findings teaches you lessons how to identify. Read my books on fish diseases, available in different languages, about the diagnosis of fish diseases, a lot of photographs telling you what you can see, how to prevent fish diseases, and also a lot of information about treatments. Here I show the Aulonocarra orange, who is becoming skinny, in bad shape, and will eventually die in the coming hours. You can see this more healthy one here in front, but this one is getting skinny, emaciated, and separating from the group and die. And that's the ones who telling you, well, something is going on in the aquarium. Please check me out. Here we see it again, how skinny this fish look like. This is not a normal Aulonocarra look anymore. And we found that the gills were damaged. See how bad the gills are here and here. Lamella are gone. So bacteria playing a role. Badly damaged here also. Intrusion of bacteria. Why? Well, maybe we have to check further why the gills are getting so badly damaged. The fish is getting weaker, proneable to diseases. Well, we found a very bad spleen with tubercles. Look at that, very bad spleen. We found tubercles in the mesenteria outside here. Those few tubercles. We found tubercles in the gut. Very specific tubercles. Doesn't look exactly like the typical tuberculosis tubercles. Well, maybe we found something that could be causing it, and that's those tiny little internal flagellated parasites, Cryptobia. Those tiny Cryptobia look different than Spironucleus or Hexamita. They behave different. They are also flagellates turning around slowly on one side, circling more, not moving quickly like a Spironucleus. And that might be a cause of the tubercle like this one here. It's known that Cryptobia iubilans probably is causing or can cause tubercles. So what can you do? Well, understand that the tubercles might be caused by the Cryptobia, that it's not fish tuberculosis, but still you can send samples to the laboratory of the organs with tubercles, and that can help you to identify if it's mycobacterium or not. The damage to the gills is usually secondary and should be treated with an antibacterial medication because it's killing the fish. But certainly the parasites needs to be treated with an anti-parasitic products like the ones you use against Spironucleus or Hexamita. You might need maybe 25% higher doses. That's the experience we have with Cryptobia. It's not so easy to kill like Spironucleus, so you might need to use a higher dosage. Ask your aquarium shop or your fish doctor what products they have. Usually it's metronidazole that is doing the best job. Ask your fish doctor or see the details in my books. And at the same time, you can use a functional fish food that helps to improve the immunity and the repair of the fish, like Dr. BASSLEER Biofish Food Lapacho. More details on fish diseases in my books, the link is below, or go to my Patreon training on fish doctoring, on prevention of diseases, diagnosing fish diseases, how to keep fish in quarantine, how to prevent diseases, understanding why fish getting sick. All training in videos I have available for you. So I hope that this video with an Aulonocarra cichlid with a Cryptobia parasitic internal infection teaches you a lesson. And I teach you many lessons. I had already more than 700 videos. So subscribe. More videos to come, more lessons to be learned. Thank you for watching.